I came in and I said, I want to find what's going on with autism. It's many, many times what it used to be years ago, and it gets progressively worse, and we add progressively more and more vaccines. So in a nutshell, and you can see it through this, we're breaking up the vaccines and we're breaking them up into time periods. Okay, not so complicated. And we think we're going to have a tremendous result from doing that. Very simply, large amounts of vaccine, large amounts of like vats of vaccine are currently pumped into your child's body. And we're doing 20% of that at each visit. And we'll let time elapse between visits so the body can handle this massive amount of fluid being pumped in.
One of the biggest changes to childhood vaccine policy in decades could be coming. President Trump just signed an executive order directing federal agencies to align with a government study that recommends scaling back the number of vaccines routinely recommended for children. The report, backed by Health Secretary Robert F. Kennedy Jr., argues that the United States recommends more childhood vaccines than many other developed countries. Under the proposal, vaccines for 11 diseases would remain universally recommended, but several others, including flu, hepatitis A, hepatitis B, RSV, rotavirus, and some meningitis vaccines would no longer be recommended for every child. Instead, those shots could be left up to parents and doctors through what's called shared decision-making. Supporters say the move gives families more flexibility and more control over healthcare decisions, but it could actually reduce vaccine rates and increase the risk of outbreaks for preventable diseases. Trump's order tells federal agencies, including the CDC, to review their policies and bring them in line with the report. For now, no vaccines are being banned, and states would still decide their own school vaccine recommendations. But this could become one of the most significant public health policy shifts of Trump's second term.
The only thing that I can see is going to happen as a result of the announcement from today is an injection of greater amounts of uncertainty and fear and confusion where there doesn't need to be any of that.
Parents are going to worry. Parents naturally worry about their kids. We all worry about what we can do to help them and trying to limit things we can do to hurt them. And one of the things that we've shown over many, many years is that vaccines are one of our most important public health interventions to raise adults, to help our kids safely grow into adults. So whenever there are conflicting messages, natural confusion amongst parents are going to lead to the likelihood of delaying vaccination. So you're going to have well-intended parents who may want to delay their vaccination because they're confused and rightfully concerned about conflicting things they're hearing about in the news or on social media. The timing of vaccines is important. That's been well studied. We give vaccines to children even when they're young because we know that's safe and because we know it's the best time for their body to respond to that vaccine in a good way and to make their body stronger to fight off an infection if they're exposed to that.
There has been no specific recommendation coming out of this executive order about how many times a child should visit a pediatrician. Spreading things out is a vague term, and all it's going to do is going to make things much more difficult to get fully vaccinated. Because the more visits you have to do, the more time you have to take off from work, the more time you have to take children out of school if they happen to be school aged. This is just going to make it more and more difficult for people to get the vaccines that they need.
This does, in effect, upend the childhood vaccine schedule, and it comes from President Trump and several others in this event just now, making claims without evidence, continuing to link autism potentially with childhood vaccines. And again, there is no scientific evidence to connect those two things. And in this executive order, in the text of it, there isn't anything about autism specifically. And the president was asked about that, and he did say that they are still looking into that. This is something that he's sort of just putting out there again as a claim without any backing of scientific evidence. But it is sort of the undercurrent to why the president is continuing to do this and to bring up this issue. And what it essentially does, Hallie, is that it would propose to limit the number of vaccines that children get, and that certain diseases that they get vaccines for would be recommended for all kids of all ages, but then there would be a group of other vaccines that would really be based on a conversation between a child's parents and a child's doctor. And then there is another even subset and group of vaccines that would potentially only be recommended, again, if there are other discussions between the child and the child's family and the doctors. But something that's really significant here, Hallie, that the president has been talking about wanting to propose and do for a while is separate out what's called the MMR vaccine. And that's the measles, mumps, and rubella vaccine that right now is given in multiple doses, but in one shot for those three diseases. And the president and Secretary Kennedy are arguing that those should be taken apart as individual shots. And so what they're saying is that children, their parents should take them for more appointments, to go to the doctor more often, but to get the shots in distinct visits instead of combined in some cases, as the vaccine schedule has been laid out for decades.
President Trump just signed an executive order for reducing the total number of immunizations recommended for children, as well as separating the measles, mumps, rubella vaccine into 3 individual shots. Here are reasons why this is a bad idea. My name is Dr. Emily, and I'm an emergency medicine physician. I am also the mother to an 8-month-old child who is currently receiving her vaccines. By separating the MMR vaccine into 3 separate shots, your child would now be unprotected while waiting for the other shots, especially when measles rates have been the highest they've ever been since 1991. Trump and Kennedy are still trying to fund research into autism connected to vaccines. It's going to be a waste of your tax dollars because decades of research have said this is not the case. Now, let me be clear. This is not a criticism because he is the president or because of his political party. None of these recommendations are backed by science or research. Don't trust the politician. Trust your doctor.
You can say whatever you want about this administration. In terms of healthcare and our kids and autism breakthroughs, this administration has done what no other administration has done. Trump just signed a childhood immunization executive order to limit shots and claims MMR vaccine can be quite lethal. He wants the MMR how it was years ago, which was measles, separate from mumps, separate from rubella, minimizing the dose of jabs that these kids get. My oldest son with autism had the MMR when he was 13, 14 months old. And thereafter, some of you know, he had a seizure. He went to the hospital, given Tylenol, unconclusive, a whole story. It's on my page down at the beginning. All to say that 7 years later, I did a titer test for him and he still has antibodies for that MMR. So why would he need a second dose? Moral of the story, if you give your child any jab, before you give any doses on top of it, maybe you should just test for antibodies if you are pro that. If you don't want to give it, that's fine too. If you want to give it in a different pace, that's great. Good for you. Your choice. However, let us have a choice on how to do things differently. And I thank them for doing that. And if you have not experienced a disability happening in front of your eyes, and you did things differently for a second pregnancy or son, and that child is not autistic, don't come at me with negativity because you have not experienced it and you have not done the research. Even if you're a medical provider, you have not done or gone through what we have. So we know best. Moms know best.
Okay, so I've been covering Trump's executive order on vaccines throughout the day. And during the press briefing in the Oval Office, Trump said some very scary stuff about vaccines, linking them to autism, a lot of medical inaccuracies there. But it got me thinking about the COVID-19 pandemic. And the vaccine development at the time was really marred in a lot of controversy, a lot of conspiracy theories. And I remember at the time, a lot of my friends texting me and saying, hey, I'm about to get vaccinated, but I'm nervous. I'm hearing a lot of scary things in my community. Can we talk? And I remember being struck at the time and thinking to myself, why am I not nervous? And honestly, we could talk about cellular biology. We could talk about my understanding of how mRNA works. But truly, the reason that I felt confident to get vaccinated is because I was in the very privileged position to be interviewing on the daily the people who were inventing the COVID-19 vaccines. And I think that when you meet people firsthand, it really takes away a lot of the confusion, because when you meet those scientists, what you realize is that those are people who are genuinely trying to save lives. So as I think about the pediatric immunization schedule, which is now kind of under threat with this new executive order, I'm also similarly in a very privileged position to be interviewing pediatricians who are carefully, thoughtfully putting these together. There's a lot to critique about modern medicine, but in general, they're people who do want to help and not harm. And so I completely understand why people are confused, because those voices are not being elevated to the same platform as the voices in the Oval Office that we saw today.
President Trump has signed a new executive order which is aimed at ending birth tourism. But what does the executive order actually do? The answer is found primarily in Section 4 of the order, titled Scope and Implementation. Let's walk through it. But let's start first with what is birth tourism. According to the executive order, this refers to a foreign national entering the United States on a non-immigrant visa for the purpose of giving birth on U.S. soil, or facilitating another person's entry into the United States for that purpose. Now, the executive order is really aimed at preventing people from using non-immigrant visas to obtain U.S. citizenship for a child born in the United States. Now, let's talk about what the order directs. First, the executive order directs the Department of State and DHS to update their rules, policies, and operational guidance to implement the order. If the U.S. government determines that someone enters or attempts to enter the U.S. for birth tourism, it may, number one, deny that person entry into the United States. Number two, deny a visa or other travel authorization. Number three, revoke an existing visa or travel authorization. 4, permanently bar that person from entering the United States. The order also reaches beyond future conduct. It says that if someone previously engaged in birth tourism or plans to engage in birth tourism, the government may, number one, deny that person's entry into the United States, or number two, seek that person's removal from the United States, which is deportation. The order also authorizes appropriate action against individuals or organizations or entities, whether they are inside or outside the U.S., that facilitate or enable birth tourism in any manner. It also directs other federal departments and agencies to provide the records and information needed for the Department of State and DHS to implement this order. This executive order doesn't abolish automatic birthright citizenship. It just focuses on preventing what the Trump administration describes as birth tourism, and it authorizes federal agencies to take these enforcement measures. This executive order is likely to face legal challenges, and we'll learn more as federal agencies begin implementing it through updated rules, policies, and operational guidance. Follow us for more U.S. immigration updates as this continues to evolve. My name is A.K. Pukwa. I'm a U.S. immigration attorney. I'll see you soon in our next video. Bye-bye.
Okay, if you're seeing posts saying Trump just changed the childhood vaccine schedule, here's what actually happened. President Trump signed a new executive order today directing major changes on how childhood vaccines are recommended in the United States. One of the biggest changes is that the childhood schedule will now be divided into different categories. There will be a smaller group of vaccines routinely recommended for all children, while some others will be recommended based on individual risk or shared decision-making between parents and providers. The order also calls for some flexibility in when and how vaccines are given, including spacing routine immunizations across several visits. And this is the part getting a ton of attention. The administration wants the combined MMR vaccine separated into individual measles, mumps, and rubella vaccines. But here's an important detail. Those 3 separate vaccines are not currently available in the United States. So this doesn't mean parents can walk into their pediatrician tomorrow and say, hey, I'd like the MMR in 3 separate shots. That would require manufacturers and regulators to make those products available again. Okay, so The order also talks about working with states regarding vaccine requirements, but the president cannot simply erase every school vaccine mandate with an executive order. States have major authority over school entry requirements, so you'll have to watch what individual states actually do. And regardless of how anyone personally feels about vaccines, this is a major shift in U.S. vaccine policy, and there are going to be a lot of details to unpack. I'm reading through the actual order now. You'll know I love doing this kind of stuff. I'll keep breaking it down, what changes, what doesn't, and what this actually means for parents.
President Trump has gone off the rails in terms of the childhood vaccine schedule. In this Truth Social post, he announces to the world that the United States is moving towards a different vaccination schedule for children that's based off of political vibes and not actual gold standard science. They don't give any reasoning that is legitimate for why they are doing this. They're not being radically transparent. They don't show any published literature explaining if there's any new safety signals or why this newer recommendation is going to improve outcomes for children. Instead, they're just spreading a bunch of lies as usual. Case in point, this diagram. In the United States, we don't give 72 injections to children. That's not what happens. If you take out all of the boosters and individualize all of the components of combination vaccines, you get around 50. In Europe, it's not 11 injections. It's significantly more. And every country is different because each country has universal health care. Their transmission rates are different. The population size and demographics are different. So it's like comparing apples to oranges when you look at vaccine recommendations. In these European countries, when they have universal health care, they've got centralized systems where they can track things a lot more easily for these smaller populations. We don't have anything like that in the United States to that extent because we're a much larger country that has both state and federal regulations, so it's much more difficult to do these things. And so having the type of schedule that we have in the United States prior to RFK Jr. messing with it made sense to make sure that we were helping as many people as possible to help even the playing field, whether you have or don't have the means to be able to have children being protected. But what's going to happen, which has already happened already, is we're seeing outbreaks of vaccine preventable illnesses like measles, which the elimination status has basically ended since we were having sustained transmission for more than 12 months. We've also had whooping cough cases all over the United States, including several children dying from this. And what will likely happen next is the rotavirus will likely come back because they moved that vaccine into the shared clinical decision-making category, not a routine recommendation. That is a virus that used to fill up pediatric hospitals with very sick children who were having vomiting and diarrhea to the point that they were severely dehydrated and needed IV fluids in order to perk back up. This is all self-inflicted, and we have no real transparency here as to why they're really actually doing this.
So, after hearing different reactions from the White House, the doctors, and other commentators, what should we actually take away from this? Here, President Trump says the changes are about giving parents more choice and reviewing America's childhood vaccine recommendations. But medical organizations and many doctors are raising concerns that changing the schedule could create confusion and potentially reduce vaccination rates. I think it's completely reasonable for Americans to ask questions. It's reasonable for parents to want more information. It's reasonable to ask whether recommendations are based on strong scientific evidence. And it's also reasonable to be concerned about what could happen if vaccination rates fall and preventable diseases begin spreading again. I think the better question is, what does the evidence show? And what is safest for children? That's the question I would want answered. And now I want to hear from you. Do you think this policy gives American parents more freedom and choice? Or do you think changing the childhood vaccine recommendations could create more confusion and risk as me? If you're a parent, what matters most to you when making healthcare decisions for your children? Tell me your opinion in the comments and let's keep the discussion respectful. Because this isn't just a political argument. We are talking about children's health.